Healthcare continues to take center stage in Washington, D.C.
That's right. Healthcare reform legislation presented by U.S. House Democrats late last week could come up for a vote in the next coming days. And joining us this morning via satellite from Washington, D.C., New Mexico Congressman Ray Luján. We want to thank you so much for joining us. Now, with this version from the House, what's different that might make it more palatable on both sides of the aisle?
Well, Deanna, you know, we came home during the August recess and we had a chance to visit with constituents across the country to be able to shed light on some of the mistruths that are in there. And after hearing from our constituents as well, we came back and we talked about some important ideas. One of the biggest improvements to the bill and what we've actually helped do is we've decreased the cost. We've listened to the president and we're now coming in right under $900 billion. As you know, it was over $1 trillion. We've also increased the level of the amounts of individuals that would get the surcharge to $500,000 and to $1 million, so that only the 0.3 most wealthy in the country will actually see that surcharge to help pay for this. And a lot of these provisions will actually go into place immediately so that we can begin providing help to people that are in trouble out there and that need some help and some relief from insurance companies.
Now, Americans would need to get some sort of health insurance under this bill, and employers would need to provide some health insurance. That doesn't seem to be winning over any Republicans. In fact, we haven't heard of any Republicans so far that like this bill.
Well, it's unfortunate that we're still not seeing Republican members of Congress come on board here. I'll tell you, as I've traveled around the district and we continue to hear stories from around the country, people need some help. And if voting for the status quo is what they want to do, that just goes to show that they're out of touch with the American people. I came to Congress to look after the people from my district, and I think that's what we're seeing from the Democrats right now. We need to do something. Insurance companies are hurting people today, and we need to make sure that we're providing relief for the American people.
We had also heard something about an option for states to opt out of this.
The Senate is actually looking at putting in a provision right now where they would actually have a public option. And as we know, the Senate was talking seriously about not including that public option for a while. Their version of the public option would allow states to opt out. And I think it's great that Senator Reid and the Senate leadership is bringing down a public option for discussion, realizing that I truly believe that this is the mechanism in the bill that will help us generate the most cost containment. And although the public option in the House bill is still not where I would have liked it to have been, it's an important piece in there to provide some competition and to be able to bring those costs down for insurance companies, especially with the high premiums that they are charging year in and year out.
Let me ask you about Afghanistan there, Congressman Luján. Of course, the president is still mulling over what to do there. We now know that Hamid Karzai apparently will stay in power there. What should the president do? And, what is your recommendation?
Well, you know, the president's been getting criticized for making sure that he's been very, very thorough in his discussions and his deliberations and in the briefings with all of the individuals around him. And I think that's bad. You know, it was unfortunate that Vice President Cheney came out so strong against what the president's doing and being thoughtful about the lives of the individuals, of the soldiers that he is considering right now. You know, under the Bush administration, they took us into Iraq saying there were weapons of mass destruction, and when we knew and we found out that there were not. I think it's important that we have a president that looks at this carefully. Now, as you know, I was out in Afghanistan and Iraq at the beginning of August, during the August recess, where I went to go visit our soldiers and get an assessment of what was on the ground. And I truly believe that the president needs to take a clear look at the number of increases, the surge in troops that we've had thus far. You know, coming into the beginning of the president's administration, there were another 4,000 troops that were sent that President Bush had made a commitment to, and shortly thereafter another 21,000, where we've seen continued increases and surges with the troops there. And we need to make sure that we're bringing the Afghan people and that they're training their own forces to put on the ground there. When I was there in early August, that's what I had heard, and that was the assessment that I got, is that the Afghanistan people and the Afghan government needed to step up. They needed to bring more and more people in, upwards of about 100 to 200,000 more troops on their own. This is the Afghanistan government. And I think that's what we should be looking at, and looking to see the resources that we recently sent out there from a money perspective, and seeing how we can get the most help to our troops on the ground, but having the Afghanistan people step up to provide more and more people and provide some of the training that they're doing already.
All right. Congressman Luján, thank you so much for joining us this morning.
We really appreciate it.
Thank you very much.
You bet.
Thank you.